Society Hong Kong Center. I'm Alice Mong, Executive Director of Asia Society Hong Kong Center, and it is really my great pleasure to be here today to do a program that I've been looking forward to. This is episode 36, and we're going to have a conversation with Dr. Judy Blaine, and we're really, since we started the series about 2 years ago, we've been focusing about talking to the experts. And that's one of the reasons we started this program 3 weeks after the first case of COVID in Hong Kong. And for me, talking to the experts takes away from the anxiety, of fake news and all of the things that are all of the noise out there. So today we have a mental health expert, and we're going to be devoting more on mental health issues in the coming days. But today we have Dr. Judy Blaine with us, and we're really delighted that she's going to share with us. You've probably already read a lot about her paper, which is the first scientific paper on the impact of the world's longest mandatory quarantine, which I believe was published about almost a year ago on the psychology and behavioral sciences in April of last year. And she's spoken about this her studies already in the press and I believe at the Hong Kong International Lit Fest that Asia Society played part in October. And she has several studies that she's going to tell us more about. And she's joining us today from Hong Kong, where she has lived in Hong Kong for about 26 years and raised her family here. And we're really delighted to welcome back Dr. Blaine to talk to us about this kind of, I call it the other pandemic or the silent pandemic, which I think is going to be hitting us. And in fact, I think Paul Ip and other psychologists, this is really the tip of the iceberg, some of the stuff that we're going to be hearing about in terms of mental health. We know Hong Kong's numbers, unfortunately, is still high. Today, I looked it up. We are actually, Hong Kong and Singapore are almost neck and neck in the COVID numbers, 975,000. Hong Kong is 975,212. And we're still behind Singapore by about 400, which is 975,607. But in terms of the death rate, Singapore is a lot lower than Hong Kong's. So we want to talk about a lot of these issues today. So before we get, I have a lot more questions, but I wanted to kind of start off asking Judith, just kind of give us a summary of why she started the study. Why did you do the study in the first place? And that was published a year ago. And then kind of your experiences this last 2 years after conducting the study. And what have you learned? Some of the stuff that we can, share with the audience today. What are some of the issues that you think some of the key takeaway from the study?
Yeah.
Judith?
Thank you very much. Thanks. And very nice to be on the show, Alice. And thank you very much for inviting me. The reason that I decided to conduct these studies was I was beginning to see after sort of 6 months of COVID. So, our first COVID case was 23rd of January, 2 years ago. But all the effects of quarantine and the effects of a lot of the expatriates not being able to go home. So I conducted 2 separate studies pretty much at the same time. So my data collection was from, I think, the 23rd of February to the 16th of March. So literally a year ago now. Obviously, one had to get ethical approval and all of that to do it. And the reason was I was seeing or hearing the anecdotal sort of evidence of people's distress. And it wasn't fear of actually getting the virus. It was deeper than that. It was more the sort of social aspects and the psychology aspects and your whole sort of emotional aspect. So I thought, well, what best way for me to do this was to take a scientific approach. So I conducted these they weren't large studies, but a qualitative approach, which just means getting people's perspectives on it. So I started off with the quarantine one, and I particularly, and this as a researcher, it's quite difficult to, when you have a strong opinion about something, to bracket yourself. So I did the quarantine study before going into quarantine myself. So I'd done my home quarantine, but I hadn't experienced hotel quarantine. So, as with everything in research, one needs to not only look at negatives. I think it's really important to find positives where we can, and not only that, but also to find tips that are useful. Otherwise, what is the point of research? So went in, and what I was quite surprised about when I did this quarantine research was that I found a framework that had been developed after SARS, and it was a bioethical framework. So basically, countries have used this framework in order to find what the best way to make decisions on quarantine and how to handle the pandemic. And these were inclusivity, openness and transparency, reasonableness, responsiveness, and accountability. And so one would think, as a base, that would be a great way to mitigate any mental health, because if a person feels inclusive, that the government has been transparent and open in the decision making, that the things were reasonably done, obviously, and don't get me wrong, Hong Kong's done a fantastic job in keeping numbers low. And even now we have Omicron, but it's not the Delta variant. And so, yes, there are a lot of deaths that are happening in the unvaccinated and the elderly, but we didn't have the massive deaths that Delta could have. So, great, that was really very well done. But I think that a lot of people in my research found that perhaps the openness and transparency, the reasonableness, certainly of 21 days, was not there. And there was no inclusivity in this decision making. So again, that was what I based my actual research on. And the findings were interesting. What I found was, this is the quarantine study, that for most people in Hong Kong, people are law-abiding, have a really strong sense of civic duty, and that most people would do the right thing. If you rely on somebody's altruism and for them to do the right thing, they will. But not only that, you will actually mitigate some of the negative connotations that come with it. A lot of the people that were in my study couldn't quarantine at home, but actually chose to go to the hotel. But they felt they had a choice in it. They felt they had some autonomy in their risk-making decisions. And I think that is something that's really important for human beings. And so that's the first sort of study. And the main things were, at the time, it was the 21 days that really threw people. And as I said, I decided to do the study prior to going into quarantine myself. And I've done 2 weeks at home, 2 weeks hotel, 3 weeks hotel. And even having done the study, I was prepared, got my head right, but it really, really affected me. The 3 weeks. 2 weeks was manageable, but it was the 3 weeks, and it was coming out of quarantine that was the most alarming for me. I felt really discombobulated. Anyway, so that's the one study, just shelved that one for now. Then the other study was looking at the psychosocial consequences for expatriates for COVID. And I'm not suggesting that expatriates are in any way disadvantaged in life or anything. And I'm not trying to marginalize any other group of people. But I think expatriates, it's a unique population here, because a lot of people come on the premise that they're going to be able to see their family back home. And, that's a given. A lot of companies actually still pay for families to fly back. And that's kind of the agreement, or the perk, for want of a better word. And so I thought I would conduct this study for expatriates. And again, what we found was I used black clouds and silver linings, again, because I think it is important that we do focus on the positives. Black clouds were separation from family, was first and foremost. Concern for youth was another big one, their social and emotional development. Missing milestones, like, unfortunately, there were funerals that were missed, as well as weddings and 90th birthdays. Also, the mental effects. The arbitrary measures came up as a very big black cloud. At that point, beaches were closed, as they are again now, and people just didn't understand the reasoning behind it. And for many, there was a financial concern. But again, there were these silver linings. So people were finding new ways to connect. They were able to sort of slow down and find the joy in small things like hiking the trails, or seeing Hong Kong for the beauty that Hong Kong has to offer. And also a lot of personal development and positive reappraisal sort of is something that came up a lot. So those were the two studies that I did on the psychosocial consequences of this, quarantine, and then for the expatriates.
I think what I find interesting with your second study, the psychosocial, in some ways you're right. Expatriates, nothing unique, but in some ways they were almost like they were the experiments. They were ahead of the curve because I feel like now here in Hong Kong, we're all in quarantine this last 2 years, which we kind of in essence are because we cannot travel, not even to Macau and definitely not to China. So in some ways, your study from the expatriate community, I think right now in some ways is showing through, don't you think, in the ordinary, the local population in terms of the some of the stresses.
Yes.
And can you talk about what some of them are? Some of them, many, for example, traveling, and that was always one of the things of, uniqueness of Hong Kong, were proximity to people, and also friends. People travel to see friends, but now, what you have talked about is the black clouds have also affected the people here in Hong Kong, for example, not being able to see their loved one who is dying in the hospitals and so on. So it kind of has I don't know if you can talk about that. I mean, don't you think you're here in Hong Kong, you're seeing the effect of it in the Hong Kong community?
Yeah, and as I said, this was a study that I just did on a small sort of population, which was easily accessible to me. And by all means, it is transferable across to everybody now. And I think what people are finding, interestingly, the WHO had published something in October 2020 called Pandemic Fatigue. And I have to chuckle because that was 2020 and we are now 2022. I think in Hong Kong, we've got beyond the pandemic fatigue even. I think people are emotionally exhausted. And I think that manifests in sort of very different ways for people. A lot of people are, it's not just that anxiety. There's become apathy. There's become, some people express it in anger. You read some of these posts on in South China Morning Post and comments, and you think, whoa, okay. But, and then I think also within Hong Kong, which is interesting, is that anyway, most adults, about 70 of the Mind ASHK have said about 75% of people won't access mental health, or there's a shame and all of that. And I think we are getting to a point where we are just seeing that anything will spark people. We've had these levels of stress and fear. And yes, there was fear of the virus, of course, a real fear. And then there was fear of being taken away as a close contact and separated from your family. And that was a real fear for many. And now we're back to fear of the virus as well, because a lot of people live in small homes and they are living, 3 generations. Their young ones may not be vaccinated and their elderly parents might not. So there's a real fear of the virus again. So it's exhausting. And it's not surprising that people are on the brink.
Right, and you mentioned the arbitrariness in your, this about the expat community. But right now, like you said, today officially the beaches are closed. LCSD is closed to beaches again, and then we're right now worrying about whether we're going to have a community universal community test, a community universal test coming up. And so the arbitrariness, and in fact, I think I had a friend, an expatriate friend who was Chinese New Year. Ended up in quarantine at Penny's Bay. And now many of the people in the local population are fearful of going to Penny's Bay. In fact, I think it was one of the news stories that quoted you in 27-hour period, there were like 4 attempted suicide, Penny's Bay alone. So how do you think, based on the study, I mean, many of the studies you talked about was from SARS in Hong Kong. I remember one of the university, I think at Hong Kong U also has done, encouraging the incorporation of, mental health in next pandemic. And it did spill over to the New Zealand recommendation. How come somehow we haven't pick up that lessons our own.
Yeah, exactly. It's interesting. So this framework is there and it's accessible. And I think we can only learn from it and hope that it will be incorporated in the next. But I think we've got to a point now where we've got to really focus on mitigating the health issues. And I think you mentioned the beach thing. What people seem to be feeling is that all these measurements are punishment, as opposed to, why are the beaches? It was stated and I don't know, but it was stated that one of the reasons for the beaches closing was that people were not abiding by social distancing measures. So, it's how things are phrased and put. And I think from a mental health point of view, there's the sense of coherence that we need to sort of, for somebody to feel autonomous in what they do, that it's got to be understandable. The measures or whatever it's got to be comprehensible and meaningful to them and manageable, So I think that if we're looking towards trying to mitigate mental health, we need to take all of that into account and not, yes, we are very concerned about the pandemic from a physical point of view, but the other ways of motivating people rather than using punishment or perceived punishment.
What do you, right now, because of, we're seeing really some crazy incidents recently, and unfortunately violence. I think there's been recent incidents the other day here in Pacific Place near the office where an elderly Hong Kong gentleman was kind of beaten. In fact, I think he's still in ICU by a young man who was apparently already has some mental issues, kind of pushing him maybe over the edge. And we're also seeing that in the U.S. I think the story is out about the gunman who shot the homeless, and he himself was also, again, had a history of mental health. How do you think the government right now can or should, what advice would you give to the government in terms of kind of learning from the other countries as well, in terms of the people who are already troubled? I feel like the area of mental health has been underinvested, not just here in Hong Kong, but I think, in almost every healthcare system. In fact, I was talking to a friend who is in the insurance business, and I kind of said to him, it's usually not covered. Seeing a psychiatrist or seeing a psychologist, it's usually out of pocket. So only the ones who can see a professional. So how would you recommend to Hong Kong government and others, to put this as a priority?
Yeah, well, there are two factors here. The first being that as things stand, according to the guidelines of WHO, Hong Kong has got half the number of psychiatrists per capita. So that is, for a start, something that needs to be addressed. There's a lot of work, sort of not, it's Mind, ASHK and other organizations that are trying to promote sort of awareness of mental health and not to reduce the stigma. I think that's also sort of a big thing. But I don't think that there are enough healthcare professionals for a start. But the other issue, and this is going back to sort of learning from other countries, is, and I go back to this framework just because it is so much, it's so easy to incorporate. Again, if a person, and I'm talking about not so much people who already have mental health issues, because that's, we're going to need psychiatrists and more professionals, but I'm talking about how to prevent the majority of people from developing mental health issues or tipping over the edge. And that's, again, I refer to feeling that decisions are reasonable and in place, explaining, having that openness and transparency. A lot of these measures that are in place, I mean, do you understand them? I don't know if I'm missing something, but I don't really understand the reason behind them. Why are children's playgrounds closed? Why are beaches closed? Why must we wear a mask when we're hiking on the trails? All these little things that make our lives a little bit more joyful now are taken away and restricted. And to what end?
Yes, I agree with you. Lately, I think there's been a talk of the government wants to, I don't know if it's true or not, but the government wants to, right now it's 2 person per table for eating. And because of restricting it, they want to make a table for one. And I asked myself, why? Does that make sense? Table for one, and then why you might as well close the restaurant then, which is, and also does COVID stop spreading after 6? Or, is there something about 6 p.m. number? So I think you're right. There is a lot of question we're asking. But I want to go back to the quarantine study. And you had mentioned in some of the articles that you've been quoted. And, what can Hong Kong learn from others in terms of before going to quarantine? Is there something that Australia, Singapore, other countries are doing a bit that we can learn from before we're dumped into quarantine?
The biggest issues, and I don't know, I mean, I believe you've done your quarantine as well. Were you asked for whether you had any mental health issues? Were you asked about any medical issues?
None.
No.
None.
So therein is a start, there was no allowance made for anybody who might have mental health issues. In Australia, my understanding is that if you have a questionnaire and if you have mental health issues, you're put in a different facility. This was when they did have the quarantine measures, and you had windows that opened. You were obviously on the ground floor, windows that opened. You had a nurse come in and check on you every single day. You had people calling you once or twice a day to check how you were. And I don't know about you, but aside from testing when I was in quarantine, there was no checkup on how I was.
Very efficient with the testing, yes.
Very official, but and they did a very, very good job and all of that. But it would just be nice to be treated as a person. And it's like, how are you doing? It must be quite tough. The call, just a sort of a sense of how are you? And I think that so that's one aspect. Another is, again, we are really quite good at Hong Kong is mask wearing. We comply with rules and laws and things. So I don't really understand why we couldn't quarantine at home if that's our choice. Give us a choice in it. Let us feel some autonomy in our risk-making decision. That'll go a long way to mitigate any negative mental health issues. Because even though we know quarantine is a good thing for pandemics, and isolation is a good thing for sure, but there are stories that I was interviewing people where they lived alone in a flat that they were paying huge amounts of money for, rental, but they then had to fork out for 21 days in a hotel, and their house was empty. So let's just sort of really look at the human person in this and allow them to make the right decisions. And I think that's one big thing we can learn from other countries. What else came up in my, it's the trust. Trust is a big thing. You're going to get much more compliance, and it's going to mitigate mental health issues if you feel that you trust the people making the decisions. From the study, it was apparent that the trust wasn't really there. Again, we've mentioned this sort of reasonableness of the things. It based things in science. I have been in touch with the government, and before the recent director of health, there was Dr. Constance Chan, and she wrote back to me. It was very, very good, and replied and sent me a study of an outlier where on day 19 they tested positive, and this was on which this study was on which they apparently based the 21 days of quarantine, despite the fact that there's loads of others that have disputed that, but this was sort of the reason given. And I think that if things are based in science, we can accept them a lot more.
And I think you mentioned trust, and but I want to talk now a little bit about the children. I think, kids, I have so many friends who are, in fact, one friend mentioned that during the quarantine with her young child, I think she developed nightmares because of the efficient person who comes and take the swabs, every other day or something. The way it's that he's dressed or she's dressed, and the fear, kind of getting the kids really anxious. I mean, in some ways, developing kids' version of PTSD, being afraid, and also kids also know that they could be taken away. I think in a recent case, we heard about the 11-month-old baby having to be separated from the mother. It wasn't just, it was a case of an expatriate, but there's been other cases of Hong Kong family. So again, that trust factor, is there a way the government could have dealt with it better? I mean, they obviously had the quarantine facility, or, they had enough, but just the separation, I think, created a lot of really negative press, and in fact, further made government people distrust the government in terms of decision. So, do you think, how do you address? Can you address that? I mean, that's an issue I've been very curious.
Do you know, and again, and I hear you, and it is, and how does one? I think that if you treat people as human beings, you're going to get a much more human response. And I think, if you think, and don't get me wrong, Hong Kong is extremely efficient and it's been brilliant. But my experience of coming back, and I didn't travel for fun, I had family emergencies to deal with. Nobody wants to travel for fun in quarantine, believe me. But the minute you come into Hong Kong, I felt you've become a QR code. And you just feel less human. And I think, and I don't know how to combine the efficiency with that just human touch. And I think that's sort of the important thing. And, and the people, I think there's also the fear of people doing their job. In that Penny's Bay, when that lady had a meltdown, she was clearly distressed. But what worries me is that as a human being, when you see somebody in distress, it's your natural reaction to try and make people feel better, right? But all those people in Penny's Bay were so fearful that they would be punished for stepping out, even if they're only close contact, that this lady was distressed all on her own. And it's, at what point of a person being distressed will we not intervene? How bad does it have to get? And that's what worries me here. What are we doing to our humanness, our humanity with these measures? That's my biggest concern.
Right. And for my own self, I think the reason I was quarantined twice last year was first trip was bereavement. I lost my father. It was almost exactly a year. In fact, he fell exactly a year ago today, and passed away 3 weeks later. And that, for me, I remember that first 21-day quarantine was already hard enough, but I think it helped me to have that 21-day when I came back. But other people, bereavement, losing loved ones, and you had touched upon the expatriate, many of them. I had one friend whose father passed away in UK, who she said if she was to go back, it would have been 40, at that time, the height of some of the wave in UK, she would have to do 40 days of quarantine total. And so she did not have a chance to go back to say goodbye to her own father. So these are all human, we've heard all of this.
Yeah.
But you're right, there was no mechanism. When you come back, you are treated like a number, very efficient. But sometimes that coolness, that coldness, the lack of humanity really makes it a bit much. And some of us can take it, and some of us did not mind it. But I think with others, and especially children or more people who are more vulnerable, it sometimes can be pushed over the edge. So one of the questions we have from the audience was, what can we do as people? We know we all have either gone through it. As an ordinary citizen, what are some of the specific ways that we can provide some psychological support with people around us?
Yeah.
What can we do? I think we feel so helpless.
No, for sure. And I think one of the key things, and this is why, and thank you for that question, because let's not lose sight of the fact that, we need to support each other, and we need to. So the key thing for me, we cannot control what's going out there, right? We can only control our reaction to it. And that's where our power lies. So, easier said than done. And I mean, more positive reappraisal. So what good can come out of this? What were the silver linings? And those were the questions I asked for all the people in quarantine and for the expatriate study. So, let's just generalize it to everybody. What are the positives that have come out of this? They are positives. They always are positives. And that's what we've got to look for. And I don't mean toxic positivity. I don't mean, let's turn all into, oh, isn't this lovely? When actually it isn't. I think it's really important to feel and express that. And the other big thing that has come out is people are almost embarrassed to say that they are not having a great time and struggling because we've got the war, Ukraine. I mean, aren't you lucky you're not in Ukraine? And yes, we are. But that doesn't diminish the fact that you are feeling the way you're feeling. So I think one of the best ways is not to be toxically positive, but to acknowledge where you're at, acknowledge and process those emotions. And yes, it's been a horrible day, but what can I get out of today? The sun is shining. I can still go walk in the country park. I can have a glass of wine this evening. I have my health. It's just finding the joy, a little bit of joy in every single day. Not minimizing how you feel.
There was a wonderful article in SCMP recently too about friendship. And I think we've all this last 2 years developed really deep friendships. we have here in Hong Kong, everybody comes and go, but those of us who have stuck here, our friends have become our family. And without, I have to say, without my friends, I think this last 2 year would have been hell. So I think friendship is deeper now, and also globally. I mean, I think there are ways. Can you imagine if there was no technology? Yeah,
Exactly.
we would not be able to see our friends and all over the world. So I think there are some silver lining, but I think overall, it has been a tough year. But another question here is, asking about the children. For the children who are isolated from friends and family or parents and grandparents and so on, how do you keep them mentally healthy? I think my understanding, you really got into psychology because of your own kids. You're looking at it, but how do you make them, help them be mentally resilient, the children?
Well, I think a lot of, as with anything, a lot comes from the parents themselves, and the children reflect the mood. It is, obviously with children, it's difficult, but I think with technology, again, it's important to, there are films, for instance, that you can look, and you can still teach a child, okay, let's go and look at Inside Out. And this is one way of just teaching emotions. Again, FaceTime, it's not the same, but it's, if you can find a friend, a one-on-one, without a doubt. And I think that we underestimate children. I think that they are incredibly resilient. And I think that we need to find, again, the little things that we can do with them. Let's take a pause now. If this is, you can't go and play with your friends, you can't go and do gymnastics and extra tutoring, go to the country park, find bugs. You just change the tone, change the pace.
Right now, what do you think some of the long-term side effect of COVID? You have mentioned some of your article about PTSD. Are you concerned about the long-term side effect of what, not just here in Hong Kong, but globally? I don't think there's going to be a normal, whatever the new normal is, but the long-term side effect on the mental health.
And again, I think that there are going to be positives and there are going to definitely be negatives. I think this is, the negatives are, for some children and adults, there are certain things that you're not going to be able to get back. their experiences, first year university, all of those things that they will not get back. The negatives, yeah, we are going to have to reassess. And I think we've got, as you were saying, the silent epidemic. I think mental health is going to be much more prevalent. I think in workplaces, there's going to be a much greater awareness, and prevalence, but then that's okay. We're going to have to change again the way we work, the way we communicate, and adapt. One of the pluses, though, I do feel, I'm a great one in finding pluses, is we've got to really look at our world and how we were navigating our world and the environment. And, lots of you hear of stories of how there's less pollution and people are engaging much more with the environment. So that's a good thing. That's a positive thing. The way we were carrying on was not sustainable, let's face it. And maybe it took the pandemic to show us that it wasn't. I mean, we were jumping on planes like getting a bus. And I know, having children at boarding school in South Africa and at university in the UK, I was guilty of that myself. So we're going to have to reassess that aspect. From a mental health point of view, we have all gone through, it's a trauma, and we've all gone through it to one extent or another. I do recall when I look back now and we sort of laugh, SARS was such a big thing, for us at the time. And where were you during SARS? And it was scary. It was really a scary time. It didn't drag on, but there was a real fear of death then. And so it then becomes a sort of, as you were saying, like an inclusive memory, a shared memory. With this this pandemic, the world has gone through it, the whole world. And I think that we can become, hopefully, united in that, and that it can just reassess ourselves as human beings.
I think you're right. I remember I was not living in Hong Kong at the time. I had already moved back to the States. And I remember coming back to Hong Kong after SARS and noticing that Hong Kong has changed because Hong Kong became more caring. And I moved to New York at the time, and New York changed after 9/11. New York was a big city with a heart. People cared about each other. So I think the a global pandemic like this, I hope it can make us appreciate each other a bit more. But see, another anxiety now that we're facing is not only are we facing here, but I feel like we're also on the verge of World War III with what's going on in Europe and Ukraine. So again, how do you assure young people? I mean, I know of children that the future is okay. I mean, that anxiety. I now hear, I don't have any kids, but I hear a lot of my friends' kids are really anxious right now, whether before it was about studies or now having to do, in fact, some friends have, temporarily left to go to the States or wherever so that they can ride out the storm. And they're doing studies until midnight, 2 a.m. and so on to fit the Hong Kong time. How do you assure these young kids or people that their world is going to be okay and we're not coming to an end?
And that's a big question, but I don't think you can. And I think therein lies the issue. Again, these things are out of our control. All we can do is control our reaction to them and the little things that we possibly can control. So, we can control our relationships with one another within that family unit. We can provide that stability in that family unit, and in the hope that by growing these more humane human beings and more interconnected human beings, that is going to translate to others, and therefore grow. I think that we have this propensity to feel in control. And I think if the pandemic has taught us anything, we're not in control. And that it's okay not to be in control. I think that we've actually really just got to let go of this idea of controlling, and we've just got to be okay with it. I know it sounds all but we can't promise them that the world's going to be fine. We can only promise them that their world in their home will be as fine as it possibly can.
One of the viewer said, what are some of the observation that you have with regards to citizens' mental health during COVID? And I want to also add on to the Asian perspective. I mean, I think the West, in terms of psychiatry, there are more psychologists. I remember seeing someone in New York. So mental health, seeing professional help was always more accepted in the West than East. And I have two particular cases I want to kind of mention and get your feedback. This is an anniversary of the tsunami was it about 11 years ago, Japan, the tsunami, again, major trauma for many of the people in Japan. And again, we underinvested underinvested in mental health, it seems to me, in Asia, and as well as the earthquake in Sichuan in 2008. I think a journalist friend at the time said, the stoicism of those who were suffering from the earthquake. And then it's almost like nowadays, it's almost like it didn't happen. So how do you deal with these trauma, the mental health trauma here in Asia? You mentioned earlier about lack of professional help. It's not just mental health experts here in Hong Kong. We know we're now getting some medical professional coming from China to help us through this crisis because of the surge. But how do we convince the government in this part of the world to invest in mental health for the long term?
Yeah, I mean, that is, and again, it's sort of altering a mindset. And I think, you mentioned Dr. Yip, who is sort of head of the suicide prevention here in Hong Kong, mentioning that this is just the tip of the iceberg. So what you don't want is to be reactive. We've got to be proactive here with regards to mental health. I think that awareness is a big thing. I think removing the stigma of mental health issues, the West and America for sure, that it's very, it's much more accepted. But even places like South Africa, mental health is not, you don't generally admit that you've got anxiety or depression. It's not something, and that needs to change here, talking about your issues. And I'm not meaning all touchy feeling, but you go to the doctor because you've got a broken leg. If you're feeling anxious, or depressed, it's an illness. It should just become a more natural, let's go and see somebody about this. So I think creating an awareness for sure. But as I mentioned, according to the Mind ASHK, we're looking at least 60 to 65% of people who are not don't have good mental well-being. And again, let's look at, and I'm all about preventative rather than curative. What is mental well-being? Let's focus on rather than on the negatives. Let's promote things like resilience and the actual flourishing of people, rather than let's sort of make people feel better because they are now ill. Let's change that whole thing. And by doing that, I think it's going to be preventative is definitely better than cure. And I think that's where, if I were to advise the government, I would look at that aspect.
How this question come from one of our members, Sunisa. How can you help someone who's finding it difficult to navigate during these times? And another related question is workplace. How do you build mental wellness in the workplace during COVID? Tips for employees and employers.
Yeah. So no, that's really good. I think that's key to how to make people feel better is adjust your expectations as needed. All right. Don't expect too much of yourself. And that's key. With workplace, don't at this time expect too much of your employees. Add some structure to your day for sure. Structure's a very useful tool because it stops you dwelling. And I'm not saying one shouldn't dwell or shouldn't process, but to have some structure to your day for sure. With you're setting boundaries let's talk about at home, setting boundaries with people in your home. A lot of people are working from home. This is my time. Sorry, let's just set up those boundaries. That's important, boundary setting. Work as well. I can give my employer X amount. I'm not going to give him my all. And it's got to work sort of both ways. The employees shouldn't expect everything at this time. You've really got to, people are depleted, and be aware of that. Again, self-care, and I know this is bandied on, but sleep is the most important, and ensuring sleep, eating healthy, exercising, all of those sort of from the physical side. But it's underestimated, actually, how important that is for your mental well-being. Connecting with friends, that social interaction. I know in Maslow's hierarchy of needs, it was sort of third, but actually social connection is huge. And this is why actually it's quite interesting. The whole concept of social distancing is damaging. You should actually call it physical distancing, because you're not wanting people to distance socially. Physically, yeah, but you still need and want that social connection. That's important. And then, people, again, bandy this whole mindfulness. And I'm not suggesting everyone go and meditate and whatever, but just finding something that brings you joy every day. One thing. That would be a flower, the smell of some lovely hand cream, whatever it takes.
This question is really a tough. Here it is due to COVID social distancing policy. A lot of people are losing their jobs or business are closed. How can they manage the anxiety, have no income?
Yeah, I mean, that is a difficult one. I think also with all of this is that with this sort of like small business people losing, it's not only the fact of the financial, but it's not, a lot of people don't feel that their woes have been taken into account. They've been overlooked. And that, as a human being, is very stressful. Yes, the government does provide and has done, the 10,000 and then the consumption vouchers, but, they're little steps like trying to persuade landlords not to charge rent. And there has to be a safety net, I think. And I know we're not a socialist country, but there needs to be a safety net for people in these extreme times, something to mitigate these negative financial concerns. I don't have the answer to that, unfortunately, from a policy point of view.
Yeah, I have a lot of friends who've asked me about that question. I think Hong Kong, in some ways, the government has talked about, Hong Kong is wealthy, we're going to throw money at conquering this problem. But I wonder, I often, I was in the States quite a few months last year because of my father's death, and coming back and getting that the consumption voucher, and I'm, that's very generous, and in the U.S. too, as also the people were being paid. But I often wonder, I would be happy to give mine away. I don't need it, and other people felt that way. I would have been happily given that 10,000 if I can persuade a old person, elderly, a year ago, to take my 10,000. I know the government does not want to take that away and as a punishment. I can understand that. But what if some of us want to use that as a carrot? A year ago, helping the elderly. At that time, we knew the vaccination rate for the elderly was very low, and maybe it's because I've been doing the program, hearing from the expert. They said if we don't, there will be other variants. There will be other variants. You got to get people vaccinated, especially elderly. And I think maybe because I've heard this, so some of us would have been easy. To give away our own consumption voucher to benefit those who would have been a carrot. And this is an area where I think the mechanism and the infrastructure, for us to feel part of the community. And I do feel, I think in your studies here in Hong Kong, we have a very efficient government, but there is still kind of this not only divide between the expatriate and the local community, as well as, the haves and have-nots. But, is there, who could mend that? I think maybe it goes back to what you were talking about before, is this, a lot of the infrastructure. What could the government have done, or the NGOs or some of the organization that kind of help mend the fences or help mitigate some of that?
frankly, and I mean, you're quite right in that I think this whole thing has made people much more divisive, for sure. You know, it's become, and you talk about that person who was beat up that old man and stuff like that. So there's become a lot of sort of blame and shame and divide, and, you know, people. And I think that this, with regard to people who are struggling, and I think if the government perhaps did a means-based, you know, consumption voucher or handout or something, but how to promote the sense of community. I think when you, again, this is what happens. If you've got a fear appeal without self-efficacy, that's when you get this defensive behavior happening. If you have a fear appeal, which COVID you know, is a fear appeal, if you provide people with self-efficacy, you're much more likely to get that whole community spirit. You know, I think this whole approach of me, myself, I, let's, you know, protect, rather than because it's imposed, as opposed to it's a collective need to protect.
I think, what are some of the things that you're worried about right now, you know, in the immediate term? You know, we are still going to the government. We have, the number have peaked and we're now in a plateau. What are you know, between now, you know, I think April 20th is kind of this magic number. The government says some of the social distancing rules will be lifted. What are some of the things that we can do right now as individuals, as citizens, to help each other through? I mean, you know, short term. Yeah.
I think my concern has been, and we've seen a lot of it, is people leaving. A lot of people leaving. Can't do much about that, but I think that, you know, all what we can do for each other is just, oh, it sounds rather pathetic, but just be there, listen, you know. We can't control it. We can't control, don't know what the government's going to say. I mean, there was talk that perhaps these measures will be revised for next week. We can only do our bit. And I mean, this is, again, you know, you set up this COVID information thing because it helped you to, I don't know, do your little bit. I did my studies because it helped me provide perhaps a voice for some people, you know, from a science point of view. I think, though, honestly, I think we've got to just believe that Hong Kong is going to be fine. And we've got to rely on the fact that it's a great city. There's a lot of opportunity still, and not lose hope.
Agree. And I still have a lot of friends. Ironically, you're right. A lot of people are leaving temporarily or permanently, but I also have a lot of friends who want to come back. Some of them have been gone unexpectedly expectedly for the Christmas holidays, but because of all the flight ban, many of them are stuck in UK, US, Australia. They all want to come back, and then and some of them are willing to do washouts in Singapore and all that. But the government won't let them come back until April, after April. So I do think you're right about Hong Kong. It is a fabulous place. Some of us choose to come back here to work and live. And I think the best day is still ahead. Echoing somebody that I've heard recently, the best day is still ahead. I think it is temporarily, but in the meantime, I think we have to help each other through this. You know, we have decided to do this program, a few weeks after the first case of COVID. It was because we feel, listening to the experts, and at that time, we felt Hong Kong had a lot to teach the rest of the world. 2 years ago, we had COVID first, China first, and then Hong Kong. And many of our actions here, and also the experts here in Hong Kong, where there's a Hong Kong U, Chinese University and all that, we felt 2 years ago we wanted to share the experts with the rest of the world about what we've learned. But now I feel we need to learn from the others. So there are, in the future episodes, we're going to invite experts from outside, and which we have done throughout this series. We've had speakers from UK, US, Nobel laureates, and so on. So we're going to continue this series. And our next episode is 37 with Professor Catherine Sun. Professor Sun is Senior Vice President at Hong Kong Shuiyan University, and they also train a lot of students in psychology. And so we're really delighted Professor Sun can join us. And we hope to have experts also from Singapore. It's time we also learn from Singapore and other parts of the world. And I think particularly I'm very interested in the area of mental health, in that I do feel this is a kind of a silent, it will become a major epidemic if we don't really address it as we go along. And so I want to again thank Dr. Blaine for being with us, and thank all of you for those of you who have joined us. And we are going to stay on retail therapy at Asia Society Store. And we also have started a quarantine membership. Those of you who might be joining us from your quarantine hotels or wherever you are, or Penny's Bay or wherever, show us your quarantine bills, and we will be happy, Asia Society, provide you a 6-month membership, because we're here, we're part of the community, and we feel it's very important that we help each other through. I think it's going to be, who knows how long the quarantine and the pandemic is going to be with us. But what we've learned this last 2 years is just that how resilient we can be together. And so again, thank you, Dr. Blaine, for being with us, and hope to have you back. And, I think this is a topic we need to continue to explore. And again, I want to thank everyone for joining us this afternoon, and stay healthy, stay safe, and stay sane.
Thank you very much, Alice.
Thank you.